If you've got chronic knee joint pain, this is one of the most important things to understand when you're trying to shift pressure off the joint and into the muscle. And this goes for every muscle across the leg around the knee, but most importantly, your quadricep muscle above your knee, because this is the one that typically shuts down with chronic knee joint pain. And very often when people try to strengthen it, they get a flare up. So this is how I navigate this process with many of my clients, and we'll use the exercise we showed you in a previous post to show this example. And this most important thing is muscle endurance, or quadricep endurance. We're looking at this muscle here. And this doesn't reflect that we're trying to get this muscle really strong or producing really high force in the early phases, because that can often exceed what the muscle can do and put pressure in the joint. We're trying to make sure that that quad can produce a low to moderate amount of force, but for higher reps, longer durations. And that's why we want to create a foundation of this initially. I want to, as a practitioner, as a physio, I want to know, do you have that foundation before we start to add harder things? Because if we add harder things too soon, we increase the risk of a flare-up. And focusing on endurance first, we are focusing on more low contraction tasks, but for long durations, that starts to build your foundation and reduce the risk of a flare-up as you progress from there, okay? And that's why in a previous post, we showed you this reclined straight leg raise in a client that got significant relief after just a week of doing this, where we're reclining back on a chair. We don't want any back support because that takes away the contribution from the abs. So hand support, light hand support, reclining back, straightening the knee, pull the toes up, lift, hold for 2 seconds. You should feel abs, front of the hip, quads, even down to the front of the shin, and then repeat that process. So 2 seconds of a hold up to parallel, drop back down, and you're going through 10 repetitions. But not just 10 reps, 70 reps across the day, every 2 hours, okay? You might find that for some people, 10 reps might be difficult. Then you've got work to do. But if you feel that 10 reps in the morning are quite easy, but throughout the day, it's getting harder towards the late afternoon, the evening, then that's reflecting that lack of endurance. And that's what we need to improve before we start adding harder things. Because like I said, the goal is not just to throw lots of pressure on the muscles initially. The goal is to gradually get pressure from the joint into the muscles, but in a way that keeps the joint calm, that reduces the risk of flaring up that joint in the process.